Welcome to Lee Health Coconut Point Cardiac Rehab. Let's take a look at what we do here. This is our monitor room. This is the place where patients set themselves up before class. They take the monitor that is assigned to them during their initial evaluations, and then they use either our help to place the leads in the correct spots or the diagram drawn on the mirror. If they've been diagnosed with heart failure, we want to make sure patients weigh themselves before starting exercise, because if they have an increase of 2 pounds or more within a 24-hour period or 5 pounds within the week, it is concerning to us due to the indication that they could be retaining fluids, which means that the heart might not be pumping blood effectively. This room is also where we take measurements for initial evaluation patients, such as weight, height, abdomen circumference, and waist circumference. First thing I'm going to mention is initial evaluations. We dedicate our Tuesdays to initial evaluation days currently because we are only offering classes on Mondays, Wednesdays, and Fridays. On these days, patients come in, speak with the nurses for about 10 minutes, and then the exercise physiologist takes over. They take measurements, then run through 2 assessments with them, the 6-minute walk test and the timed up and go test. The 6-minute walk test helps us assess the patient's aerobic capacity and endurance. The tug test helps us to assess the patient's balance and if we need to classify them as a fall risk. The EP would then discuss with the patient the exercise goal they deem most fitting. I was tagging along for a few weeks as just an observer in order to grasp a good idea of how Tuesdays worked and what needed to be said and done, but soon I was the one running pretty much everything. From taking measurements, going through the assessments, asking RPE and other symptoms, to educating the patient on what range of exertion is most favorable for therapeutic exercise, and providing patients with an exercise goal to follow at home. Here we have the pain scale, RPE scale, and angina/dyspnea scale we use. We use one of 2 cards to assign to each patient during their initial evaluations. Everyone gets a white card unless they are our heart failure patients, so we know to get their weight at the start of every class and to acknowledge any other necessary aspects if they pertain. We then take all the information we gathered from that evaluation and input it into the computer. Each patient then gets assigned a color that shows up on the screen for us to be able to recognize what patient is classified as what while they exercise. The colors are white for when a patient does not require any other interventions, yellow for when they are a fall risk, orange for when they are a fall risk and diabetic, purple for when they have a pacemaker, green for when they are diabetic, and blue for when they have a heart failure. This is our exercise floor. Here we take resting blood pressure and oxygen on patients when class first starts, and then we allow them to exercise on whatever machines they want. The rundown for throughout each day is that we help them on the machines if they need it, we talk to them about their goals, exercise, nutrition, lipids, and psychosocial, we answer any questions they might have for us, and we monitor their rhythms on the computer. We have a total of 6 classes each day, each with different patients, so we are always conversing with someone new. On Wednesdays, we have education days. On these days, we end class about 10 minutes earlier and have the patients return to their seats where we then discuss one of the 13 topics planned out. I was one of the people who spoke to the patients during the exercise topic as it pertained most to what we have been learning in the exercise science program. These topics allow us to give patients all the knowledge necessary to make heart-healthy decisions and understand safe practices. This is where the team sits during office hours. They utilize the computers here to input patient information, answer any emails, use patient profiles to complete charts, and other work that pertains to making sure that patients have all the information they need at the ready. What I do during these times is help out anyone who needs it by doing any math to find percent increases in average blood pressures on the patient progress reports, writing down patient goals, doing research assignments, and on Tuesdays for initial evaluations, I use the computer to input new patient information so we can have everything organized and ready for us when the patient starts to day 1 in class. That wraps up what goes on here at Cardiac Rehab. I thoroughly enjoyed my time here and feel that I have learned so much from everyone, including the patients, that I'll carry with me into my future career. The hands-on knowledge, support, trust, and experience I received has been invaluable.